Wake up. It's the Sleep Unplugged podcast, episode 144, Missing Sleep Apnea. I thought someone would notice. Welcome, everyone, to the Sleep Unplugged podcast. My name is Chris Winter. I'm a neurologist, sleep specialist, and your host for this episode of the podcast. If you want to communicate with the podcast, you can. You can follow me on social media, Dr. Chris Winter Instagram, Dr. Chris Winter Twitter. We have a YouTube page where we post all the videos of our content. We also have a Threads page, Bluesky, all of these places you can follow. You can DM me, let me know what's on your mind. And we didn't do comments, corrections, criticisms last week. We will definitely do it this week. Last week was a big episode. We did the pillow fight. We are down to our final four, which I believe are Coop, Layla, Twyla, and Pluto. Really appreciate all the feedback about the episode. It was overwhelming. I'll be honest, I didn't mean that episode to coincide with my yearly spring training trips. It was a lot, but it was really fun. And one of the fun things that happened just sort of spontaneously was working with the Blue Jays here in Florida allowed me to pack my car full of the pillows and take them on the road. So a lot of the pillows from the 2025 pillow fight were dragged up to the spring training of the Toronto Blue Jays. It was a lot of fun to basically say, look, how many of you think about your pillows? And it gave people an opportunity to really get hands-on with pillows and kind of see what's out there. I've thought a lot about the podcast and, it's been fun to kind of do the brackets and the winners and losers, but there's a lot of issues related to this. I really don't think any pillow lost. There wasn't a pillow that I took up to Dunedin that somebody didn't feel like, hey, this is a pillow that could really work for me. Not to mention the fact that it's difficult, with so many customizable pillow options. I'm thinking about that Luxome pillow that has 3 layers of different firmnesses. Each layer is not only customizable, but you can move it around in the pillow or take it out and only have 2 layers. So to actually judge a pillow that has infinite varieties of combinations was really difficult. So it almost became out of the box what pillow sort of appeals to you. Anyway, having a lot of fun with it. I really want to again appreciate all the pillows for being a part of it. And we will have a winner this week as the bracket plays out. Comments, corrections, criticisms. I'll feature two. I want to go back another episode to episode 142 on daylight saving time. This is a matter that is still not settled. And we talked a lot about that. And I put some postings on social media about daylight saving time, the website savestandardtime.com, because we here at the Sleep Unplugged podcast follow science and would really like to see the permanent adoption of standard time. And a lot of you agreed, some of you did not. Some of you made it very clear that you didn't agree, like Michelle, who wrote, no, no, no. I prefer daylight saving. Well, she wrote savings time. It's saving time. I like to eat dinner, relax a bit, and then go out and take a nice walk before it gets dark. The dads are outside playing with their kids after they get off work. Nobody does shit early in the morning. So thank you, Michelle. I read Michelle's the dad's thing was a little creepy to me. It's sort of Stepford. All the dads go to work and the women. So anyway, I read that because it really reflected a lot of the sentiment for keeping daylight saving time, which is, in a nutshell, I like it. And let me tell you something, I do too. I agree with you, Michelle. It is kind of depressing for me to finish up clinic and maybe go to the gym, just immediately go to the gym or take my dogs for a walk and walk out of the gym and it's dark. Because when it's dark, I kind of feel like, well, not going to water the garden, not going to mow, not going to get anything done outside. It's kind of the day is over, even though when you look at your watch, it's quite early. And I know in other places it's even worse. But I'll tell you something else I don't like is waking up in the dark. It's really difficult, really not good for us. So I really want you to think if you have a really negative reaction to the idea of permanent standard time, I want you to think about is it what you like or is it what's best? And those can be two different things. We don't have to like what's best for us. So appreciate that, Michelle. I'm going to read another comment from Grace about the pillow fight episode. I love Dr. Winter's big pillow energy. And then that's parentheses BPE. And I'm just going to leave it at that. BPE, big pillow energy. I think there was a lot of big pillow energy in last week's episode. So the musical reference in this week's episode is one of my favorite bands, Counting Crows. The line I thought someone would notice is from their song Have You Seen Me Lately, which was never released as a single, even though it was featured on their second album, Recovering the Satellites, which was 1996. And then they also did a interesting live album after that was done that had songs from VH1 Storytellers, which was sort of acoustic, and then MTV Live from the 10 spot, which was, kind of the second disc and a little bit more raucous. And they actually did Have You Seen Me Lately on both. And this is a song that my wife really likes the slower acoustic version, and I really, really dig the 10 spot version. So, as part of your homework, we're going to put both versions on the Spotify music playlist of Have You Seen Me Lately? And you're going to tell me which episode you like best. And the other song off of uh, Recovering the Satellites, which was just to me an amazing, amazing song, was A Long December, which apparently Fred Durst, the lead singer, said it's the only song of his that he never doesn't want to play in concert. And one of the running jokes on the Sleep Unplugged Spotify playlist is we mention Chelsea as much as we can. Technically, the Chelsea Hotel, but Chelsea is a recurring theme on this. And in keeping with that, if you listen to the Across a Wire live in New York City, the first disc, the VH1 Storytellers disc, contains a previously unreleased hidden track called Chelsea. And so we'll put that on there as well too. So let's get into this. Why are we here? Why are we doing this? I just kind of wanted to rant a little bit. So this is going to be a rant episode. You can cut it off anytime. We'll try to keep it relatively short because nobody wants to hear a doctor rant for a long period of time. The rant came about because Lilly, the pharmaceutical company, and their drug Zepbound has recently been FDA approved for sleep apnea, which I think is great. I think it's going to help a lot of people get access to that medication. And I think any way we can come at sleep apnea is a positive. And I did a little work for Lilly. A buddy of mine was in West Virginia working out at a Planet Fitness. He said, I saw you on TV talking about sleep apnea. And so we did sort of a satellite media tour talking about sleep apnea. And if you're not familiar with a satellite media tour, it's this thing that somebody can do where you do the same interview in a lot of different places. I often do satellite media tours for Canadian broadcast, CBC, where they will call me up and say, hey, there's something in the news. Would you like to talk about it on a little satellite media tour? And I'm like, great, sure. So you start off at 6 a.m. in some East Coast Canadian city in their radio broadcast, network. And so it's Toronto, then Montreal, then Medicine Hat, then Moose Jaw, then Saskatchewan, and you go all the way across the country doing an interview every 10 minutes. That's essentially the same interview, just with a different host. Hey, it's John from Moose Jaw, and we're talking to Dr. Winter. He's a sleep specialist, and we're talking about this thing and tell us about that thing, Dr. Winter. And well, Dr. Winter talks about that thing. And so they ask about three or four questions. Like, great, well, if you want more information about that, you can find it here. And you hang up and then you do it again 10 minutes later. So we did the same thing with sleep apnea. And I was struck as we did it, talking over and over and over about the incidence of sleep apnea and thinking, God damn it, this is the same incidence that it's always been. It's kind of weird. I don't know. I think as you go into medicine, you think, well, the landscape that I'm seeing now is going to be very different from the landscape when I'm 20 years into this thing. But let's think about, we'll stay in the realm of sleep. Let's just think about the way we record a sleep study. So when I got started, you recorded a sleep study with something called a polysomnograph, which was this massive, think about something the size of an old phone booth. The phone booth you go inside. Remember about Robert De Niro's scene in Goodfellas when he finds out Joe Pesci's been killed and he's inside the phone booth and he takes the phone and just slams it over. That's such a great scene. So again, think about that size of a device. That was the thing we used to record sleep studies. It was absolutely massive. Now it's tiny. It's a laptop. It is a tiny little connector box. Like the technology change since I've been in medicine is incredible. Let's go back even further. When I first started doing sleep research in 93, the pulse oximeter I used was the size of a briefcase and terribly expensive. Now you buy one on Amazon, it's 15 bucks, it fits on the end of your finger, it's elegant, it's perfect, it's amazing. So things can change. Technology can change. Our understanding of things can change. We've known how to diagnose and deal with sleep apnea for a very long time. And when I would kept saying 26 million people over and over in that satellite media tour, I was kind of irritated by the end. This is something that should be eradicated. I've been thinking about Jimmy Carter recently, and I went to Emory Medical School. He was very involved down there, complete humanitarian, amazing guy. And he said, I'm going to eradicate guinea worm, or eradicate measles, which is something we have the capacity to do. I think we did. It's coming back because, the vaccination controversies that are happening right now. So we'll deal with that consequence. But we could get rid of sleep apnea, or at least really make a big dent in it, I think, if we wanted to. I don't think mandatory sleep studies for individuals over the age of 50 are going to work, but even the diagnosis of sleep apnea a long time ago involved coming into a sleep lab, expensive sleep study, being hooked up, inconvenience. And then once you were diagnosed, you would often go back to the sleep lab, hooked up, expensive, inconvenience, 2 nights, one night to diagnose you, one night to figure out how to set the CPAP. Today, we don't really even have to do that. We can do a home sleep study with a little device you can take home with you in your own bed one night. And if you have sleep apnea, we can order you an auto CPAP that titrates itself. Yet we still talk about 10 to 20% of the adult population. Let's call it 10% of 262 million people. That's 26.2 million people, 80 to 90% undiagnosed, even still today in 2025. So I wanted to do a podcast that was relatively brief, that really pleaded for this to change. And I think about this a lot. So from my end, today's Sunday. I'm going to see 15 patients tomorrow in my clinic. Maybe a few of them that will be new. And maybe somebody will be here because they're being evaluated for sleep apnea. And we'll do that. Well, okay, great. You snore and you've been a little bit tired and your weight's been a little bit up. Okay, we'll do the sleep study. So We've talked about this before. Sleep apnea, more than five breathing problems per hour, all the way up to, I think the worst I've ever seen is 150. So think there's your range. And now in episode five, we talked about mild sleep apnea, what to do with that. But the unfortunate thing is, I see a lot of severe sleep apnea. So when a patient comes back and their sleep study shows 77 breathing problems per hour, that's been going on for a very long time. That has been hurting your health for a very long time. That has been creating disturbances with your heart and your cognitive function and all kinds of things for a very long time. So I just wanted to kind of think about ways we could create dialogue and maybe come up with some reasons why this is so much of a problem even today. I often ask that patient, okay, you've got 77 breathing problems per hour. What does that mean? It means you have really bad apnea. Wow, okay. It's probably the reason why you're tired. It might be contributing to your weight. It might be contributing to your blood pressure. Has anybody ever talked to you about doing a sleep study before? By far and away, the most common answer I get is no. It's not, well, yeah, my primary care doctor's been after me for years to do it because they're worried about my heart, blood pressure, my increased heart rate, my weight, my whatever, my mood, my cognitive. It's generally partner derived. Like, well, no, my wife just told me to come. My primary care doctor hasn't said anything about it. And I don't get that. I don't get that in 2025. Man, that would be the rubberest of rubber stamps for me. Patient walks in, they're overweight. You get a sleep study. Oh, patient comes in, their blood pressure is a little high and they're already on a blood pressure medication. Yep, stamp. You get a sleep study. You get a sleep study. You get a sleep study. I would because they're so cheap now. We could do a home sleep study for a couple of $100 and insurances never deny them. So anyway, let's talk about why. 80-90% of people are undiagnosed. Why? I mean, I think the obvious number one answer is because it's all happening in sleep. And as I said over and over in the satellite media tour, when you're asleep, when something happens, you don't know it's happening, which is so interesting to me because a lot of times patients will say things like, well, my partner says I choke and stop breathing and snore and I have terrible dreams and but and they're kind of saying but we can't believe her, right? I don't know that's going on. So I think we have to really get out there this idea that you don't have a say in this matter. If you're the patient, you don't get a say. If your partner, your friend, your camping buddies say, listen, you're kind of scaring us, you stop breathing, they're not joking. They care about you. It's scary to hear somebody sound like they're suffocating. We need to act on this. So if you're somebody who's been told after a surgery, after spending the night in a hotel with somebody, after a camping trip, after a family vacation, that you stop breathing, please act on that right now. Not tomorrow. Don't wait. Do something about it right now. The symptoms are also problematic because they're pretty non-specific. If you said, okay, Chris, give me the top three things to look for in somebody who has sleep apnea, it's probably excessive sleepiness, fatigue, some cognitive issues, word finding difficulties, brain fog, tip of the tongue, poor concentration, attention focus issues, and then it's probably something cardiovascular metabolic, weight gain, high blood pressure creeping up, etc. I would also throw in their mood. I think depression or something that looks like depression is in there. So you go to your doctor and say, when you're asked, okay, yearly checkup, how are you doing? Oh no, I'm 50 some years old. I've just been more tired lately. And man, I keep misplacing my keys all the time. Nobody's thinking, oh, that's because your upper airway's collapsing and you can't breathe at night. I mean, do you know what I mean? Like there is a jump there. It's a huge jump with young people, but for older people, who isn't going to the doctor and complaining about these things, right? The third thing I think kind of goes along with number one and number two is the lack of awareness. And what I don't get is there is no lack of awareness with your primary care doctor. We were just talking about certain narcolepsy medications, how a lot of times when we were talking about an ER was confronted with a patient who was on a narcolepsy drug. It's kind of a rare one. It's an orphan drug sort of thing. And the ER doc was not familiar with it. Now, no big deal. You look it up. There's tons of things in medicine I'm not familiar with. I don't think your primary care doctor, the doctor responsible for taking care of you, is not aware of sleep apnea. In fact, I would bet that if somebody brought it up, like, you're going in there, how are you doing? Well, my focus has been a little weird and my blood pressure's not been great. And, you know, do you think it could be sleep apnea, doc? I don't think there is a doctor out there who's saying, no, I don't think it could be sleep apnea. I think they would all say yes. I really believe that. I really believe that not only is there awareness, but if you bring it up to the doctor and say, what do you think, doc? Do you think my weight problems over the last couple years and my concentration and my mood and my fatigue and brain fog, do you think that could be sleep apnea? I think every one of them would say, yeah, I think it could be. And I think if you said, well, should I get a sleep study? I would be shocked if any of them said no. So then why do we have so many people who are not getting the sleep study? So I think it's time for you to advocate for yourself. I also think it's time for you to get a little pushy with the person that you love. I think a lot of people listening to this podcast know that the person that they are with has sleep apnea. And maybe you said it one morning, you were really snoring last night and your breathing didn't sound good. You might need to get that checked out. Oh, I'm too busy or I'll do it later. There's a million excuses. I think you got to be pushier. Like, sweetheart, I'm going to call your primary care doctor today and ask that they do some sort of sleep study. And if your partner's like, I'm not doing some sort of sleep study, that's all, it's not real medicine. I don't know what the excuse is. I don't have time. I don't want that. I don't want those wires. The sleep study that needs to be done for your loved one is a really easy sleep study. It is a little thing on your finger, a little thing underneath your nose, a little band across your chest. Pretty much that's it. Now, I do see a lot of patients, even still today, who I think would have been very appropriate for a home sleep study that have an in lab. So I think it's definitely in bounds for you to say, if you go to that specialist and they say, well, we'll get you set up for an in lab sleep study, for you to say, I was actually hoping we could do a home sleep study. Now, home sleep studies are typically not approved for kids, but for adults, when the concern is sleep apnea, I think it's absolutely the preferred test. So I do worry sometimes that people are being shoveled into an in-lab study for reasons that aren't great. Like you own that that sleep center, and that's where you make money. $3,000 for a home sleep for an in-lab study, $300 for a home sleep study. So there's definitely money to be made in that in-lab study. So I don't know what forces are driving people to that place, but I think it's absolutely in bounds to say, I want a home sleep study. I mean, I want my patients to not be in a sleep lab. If they have to have a sleep study, I'd love for them to have a home study. Is the home study appropriate for every patient? No, it's not. But I think we've really got to embrace and publicize the home sleep study because I do suspect that the idea of an in-lab study. And in some places, like I said, they're still doing that in-lab study. Hey, Chris, you've been diagnosed with sleep apnea. Okay, what are we going to do about it? Well, we have to do another in-lab study so we can get the CPAP set up for you. I think if you're in that situation, you can say, couldn't I just do an auto CPAP? Like I said, there is a pathway for you or your loved one where you never step foot in a sleep lab, and it's perfectly fine. I think it's the way we should do most people who need to be evaluated for sleep apnea. And there's nothing wrong with it. Now, is it as accurate as the in-lab study? No, but do I really care if you have 77 breathing problems per hour or 62? No. You've got a lot of breathing problems and we need to deal with it. And if there's a problem, the home sleep study is not exactly what we need or we need to go further, could you go back and do an in-lab? Sure, you could. If you get that auto CPAP, take it home, and for some reason you just feel like it's not working, could you go back to do the titration study? Sure. Ask me how many times in our practice we need to do that. Very few. Very, very few. What are some other reasons why we're missing it? It overlaps with other disorders. And the treatment of them might actually be misinterpreted. Think about it. I've got depression and ADHD. But really, my symptoms of poor concentration and mood are coming from sleep apnea. But I'm diagnosed with depression and ADHD. I'm put on Wellbutrin, it's a little bit of an alerting neurotransmitter and a depressant. And I'm also put on a little bit of Adderall for my ADHD. Am I going to feel better? Probably. So when you ask me the question, okay, we've made this diagnosis and started you on these two medications, and you've come back now a couple months later, how are you doing? You're probably doing better. So before you pat yourself on the back, did you fix anything or did you just give somebody a stimulant and a wakefulness antidepressant that's kind of putting a band-aid on the situation? Ask their partner. Hey, they're feeling better. What are you noticing? Well, I'm glad they're feeling better, but I still hear that snoring, choking, disturbed breathing that I heard before. In fact, it's kind of worse now, but they feel better. So I don't know what to say. And when I brought up, well, maybe you should still do the sleep study, they're like, why? I feel so much better. So we have to be very careful how we not only look out for symptom overlap or condition overlap, but also misinterpreting symptoms and also misinterpreting improvement of symptoms. I'll put a special little asterisk by women. We really underdiagnose women. I mean, I'm fighting, to be honest with you, I'm fighting the urge as I give you these examples to say him and her, because that's what's popping up in my mind. That we've really got to get away from the heavy guy truck driver is the person who has sleep apnea. It can also be the small, thin woman, especially after menopause, where a woman's risk really starts to equal that of a man's. I think we also have to pay special attention to individuals who may have disorders that predispose them to sleep apnea, big tonsils, Down syndrome. There's several things that you can see where individuals may be more likely to have sleep apnea than not. I also think about estrogen as being somewhat protective in sleep apnea, which is why younger women have it less than older postmenopausal women. So we also have to be careful in the the trans community where transitions are accompanied by hormones or medications that block hormones. Because if something is blocking estrogen, a transition from man to woman, I'm sorry, from woman to man, that blockage of estrogen can put that individual at a really high risk of sleep apnea. So I hope that in those clinics, there is education happening about, listen, we're going to do everything we can to make these transitions positive for you, but this transition is going to carry a bit of a risk for sleep apnea that we want to be aware of and on top of. What else? Um, Again, providers. I think we have to be very careful with that. Yeah, I often see things about lack of provider awareness. I don't think that's a real thing. I think it's lack of provider time. You come in for a reason, you're coming in for some pain in your hand. It's probably arthritis, but you're not really sure. So you're there with your primary care doctor. You get your blood pressure taken. It's high, but it's kind of written off as well. Your blood pressure's high because you're in pain. You're anxious to be around the doctor, etc. I think every opportunity we have with patients in front of us needs to be an opportunity to talk about the signs and symptoms of sleep apnea. It's unfortunate. I'll step up on a soapbox for a minute that Medicare is threatening to take away telehealth from Medicare patients and making them go see their doctor, which I vehemently oppose, not only because I do a lot of telehealth myself, but because I know that a large portion of that population will simply not seek medical care if you take the telehealth away. And that telehealth provides providers an opportunity to ask questions. Do you fall asleep driving? Do you nod off watching TV at night? Does your partner say you snore? Has your weight been going up? What is your sleepiness level like? Under what circumstances? We can ask questions that lead us to, hey, I think it might be a good idea for you to have a home sleep study. And we can do that without you coming into the clinic. We can do that in your own home. We can arrange for that auto CPAP in your home. I do it all the time. So I think that provider awareness and that provider aggressiveness has got to be there. It could be something as a questionnaire about sleep apnea you fill out in the waiting room of your provider. I get it, providers don't have a lot of time, but think about this model. You've gone into your primary care doctor and you've sat down. In that paperwork that they have you fill out is a very simple questionnaire asking you a few questions: height, weight, neck thickness, do you snore? Have people talked about hearing you stop breathing? Do you feel sleepy, etc.? Very quick. It can be easily scored. You go down to sit with your primary care doctor. They can score that very quickly. If you score above a number, there is a discussion. Hey, there's this little screening thing we call a stop bang, and you actually scored quite high on it. Has anybody ever talked to you about sleep apnea? Yeah, I've had a couple people talk to me about that, including anesthesiologist who mentioned something about it, and a bunch of people in my family have sleep apnea on CPAPs. How would you feel about me setting you up for a home sleep study? Or you don't really want to fool with that? How would you feel about me setting you up to see Chris, a sleep provider here in town, for a virtual visit, and he can get you set up maybe for a sleep study? He's a pretty decent guy, and I think you'll get along with him, and it wouldn't take that long. And you know, so that's it. How long did that take us? 30 seconds? And then one of two things are going to happen. You're right about it. And they have sleep apnea, and wow, you just radically changed the trajectory of that person's life, or they don't. Okay, check it off, move on to the next person. It was a $300 home sleep study and they don't have it. Great. I think it's easy. Fear of treatment. We've got to do a better job in the sleep community of getting information out there about how easy it is to treat sleep apnea. One thing I'm kind of tired of, not 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 to be a, I'm tired of World Sleep Day and World Sleep, Sleep Month, or I think March is World Sleep Month. You can tell how much I pay attention. I've been in this field for a long time. I could give a shit about it. I don't care about World Sleep Day because it doesn't do anything. Happy World Sleep Day. Now, I think World Sleep Day needs to be something incredibly proactive where, I don't know, we all film ourselves wearing a CPAP or something or an oral appliance. Like on World Sleep Day, everybody asks the people they love four easy questions about sleep apnea because there is no bigger sleep problem than sleep apnea. So let's do something with World Sleep Day. Let's change lives on World Sleep Day. There's got to be somebody smarter than I am that could figure this out, right? World Sleep Day could be your job is to talk to five people you care about and have a conversation about sleep apnea. And there's probably a World Sleep Apnea Day at some point too. I have no idea when it is. I have no idea what we do with it, but this could be something really transformative if we got into it. You want me to wear a CPAP on World Sleep Day and film myself doing how easy it is? It's not a big deal here. I got an oral appliance right here next to me. I'm going to put it in my mouth. It's really not a problem. This thing right here, there it is, could treat sleep apnea right there for you. There it is. That was the treatment. You just put the thing in your mouth and sleep with it at night. Dentists can make them. There are surgeries. We've talked about this in other podcasts. There are means to treat it here, but I think people are scared. What's there to be scared of? I mean, do I want to wear this thing in my mouth? No, but I also don't want to have a massive heart attack when I'm at a family gathering or I have this fear. I travel a lot, and my fear is massive heart attack. I was just in New Orleans and visiting with some amazing sleep doctors. I mean, some really great sleep doctors. And my fear is, I have this great meeting with some sleep doctors, head back up to the hotel room, and I'm doing some work and put on White Lotus and I have this massive heart attack, and then that's that. So if wearing this thing in my mouth or a CPAP or having some sort of procedure prevents me from having sleep apnea and a heart attack, I'm all for it. We've got to get over the fear of treatment. Whatever you have in your mind about sleep apnea treatment is not that big a deal. Do you know how many people? Let's take 100 people who have gone through it all, gotten on CPAP. Let's have conversations with them. You know what the conversation is at worst? I don't really care for that thing, but it really makes a difference in my life. You hear it over and over and over. It's what keeps sleep doctors going. We love treating sleep apnea because it transforms people. Difficulty getting a sleep study. I can see that. And I can't speak from an intelligent perspective because I'm not everywhere around the country at once. But I can tell you this, the introduction of that home sleep study has made it really easy. In fact, the bottleneck of a lot of places getting a sleep study is the sleep labs are kind of overrun. It's a four-bed lab, it's understaffed, blah, blah, blah. My guess is if you had a conversation with your primary care doctor tomorrow, he called them up and said, I want to talk about sleep apnea. I heard this podcast and I'm going to do something about it. He has inspired me today to do something about it. Can you just order one, doc? Like, do I have to go to see the sleep specialist? Do I have to go see Chris? I don't want to go see Chris. I've heard what Chris has to say. I don't want to see Chris. I just want a sleep study and I want to move on with my therapy. Can we do that? Yeah, you can. In fact, your primary care doctor could probably do it. Your dentist might be able to do it. In fact, I don't think it's great. I'm not a huge fan of them, but they might be able to order a test that gets mailed to you. You wear it, gets shipped off somewhere, you mail it back. Some doctor sitting in Indiana will read it, and you get a report. And if it says, okay, yeah, 37 breathing problems per hour, you're in business. You got it. I mean, if it's marginal, maybe you want to do some more investigation, talk to somebody locally. I don't know. But forget that. Forget the marginal. Forget the mild sleep apnea we talked about in episode 5. You got heavy duty sleep apnea. Okay, well, you just did it in the comfort and privacy of your own home with a doctor you never even had to talk to. Now you and your primary care doctor sitting there talking about a document that says you have 37 breathing problems per hour. What can you do? You say to your primary care, can you just order me a CPAP? Could you just look up online where the home care companies in the area? I can tell you the home care companies in my area, Lincare, ABC Apria, uh, Adapt Home Care, like Arrow Care. There's all kinds of places around, and you just call them up and like, hey, I got a sleep study here, and somebody who has symptoms of sleep apnea, can I order them an auto CPAP? I mean, get at any point you could say, look, I don't feel comfortable doing that part. I'm going to send you to a doctor who manages sleep medicine. But primary care doctors are capable. Now, whether they have the time to commit to this, I don't know. But you can get a CPAP. So and you can get a sleep study. So don't let red tape get in your way. Hell, I mean, it's you call up and like, well, we can get you in for 6 months. Okay, great. I'll take it. And 6 months from now, you're going to have a sleep study and get diagnosed. I mean, you've waited this long. What does 6 months matter, right? I mean, I'm not saying that's ideal, but don't let the wait. Well, if I have to wait 6 months, forget about it. Well, listen, in 6 months, you could be diagnosed and treated, and this chronic medical disorder gone. Or 6 months from now, you're in the same boat. So let's do it. And I guess the final thing is people vary in terms of how significant their sleep apnea is. We see people largely when things get bad. I fell asleep driving and crashed my car, or I fell asleep during a wedding, or I did something dramatic. Let's not wait for the dramatic, please. Let's not wait for the dramatic. I want to find the mild sleep apnea patients, the moderate sleep apnea patients, and get them on the radar, whether we treat them or not, and just have that understanding as we go forward. So let's make a dent in sleep apnea. I want you to think about somebody you care about, mom or your dad, coworker, friend, partner, family member, somebody. And I want you to have that conversation with them about, hey, you snore, you stop breathing. I think you should have a sleep study. It's easy. We can do it today. Today, literally today. You call and you do it today. Talk to your primary care doctor about it. Let's really try to work on reducing this number that never changes. So that's it. Done and dusted, sleep apnea. I want to make a bigger difference in sleep apnea than I am right now. If you have ideas about sleep apnea, let us know. Dr. Chris Winter, Instagram, Dr. Chris Winter, Twitter. We'll announce the rest of the pillow cube. I'm sorry, the pillow cube. I'm tired. We'll announce the rest of the pillow fight winners. Pillow cube, you fought a great fight. You made it to the final eight. Couldn't quite get to the four, but we love you, Pillow Cube. Anything else you want to talk about, let us know. Dr. Chris Winter. Follow the Instagram, follow the podcast, see us on YouTube. And until next week, sleep well.